I'd like to call to order the special study session for October 19th, 2023. Please stand for the pledge. Pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, please.
Here.
Present.
Wayne Pondinas.
Present.
Gerald Swets is absent. Michael Schilling.
Here.
Joe Wizawati.
Present.
And Beth Hernandez present.
All right, moving along. Discussion items 1 and 2 you want removed?
Yeah, we're asking that we take these off of the agenda for tonight. We're going to be restructuring these for a more beneficial plan for the town. We'll revisit these at the Town Council, RDC, and Plan Commission for next month.
All right, moving on, item 3, Myers-Glaros Insurance for the 2024 renewal.
Good evening. Matt Glaros from Myers-Glaros with Rob Adlard to discuss the packet you've got in front of you here. We're somewhat of insurance geeks, so if I get too deep in the weeds, just pull me back a little bit and tell me to keep going, okay? And we don't want to take up too much of your time, but we want to hit the major parts, right? And so what I'm going to ask you to do is actually go to what I'll refer to as the third page from the end, and it's going to have a chart that's labeled claim report, time period, rolling 12 months for the last 12 months of the year. We want to start here just to give you an idea of how the plan's performing, and then we'll discuss what the rates will look like for 2024. With one caveat, with some information we were provided earlier, we do have what I'll state as probably a revision for the official vote when it comes to the council later this month. So as we go to this report, it's important to first kind of lay out the framework of it. The idea of it is to give you an idea of what the town spends on a total cost perspective. This does not include any employee contributions. This is the total cost of the benefits plan. So we start with the administrative costs on the far left. That is paying for the cost of the TPA, who handles the medical claims and handles ID cards, questions for any of the employees. Okay, so very simple. They act as your intermediary for paying claims for you and answering questions for the insurance company. You paid them a total of about $46,000 over the last 12 months. That is currently with HealthComp and has been with them, formerly known as BAS, for a number of years. Your stop loss, if you recall, in May, the decision was made to get the stop loss on a calendar year deductible. So the plan will renew on the annual basis of January 1 through December 31st, more in line with budgeting and understanding the budget and constraints that we have with the expense of insurance. In 2023, in May of 23, you elected to join a captive to help stabilize your stop loss increases, as well as it was the most financially incentive. It had the best financial incentive to go to it. At that time also, we recommended, and you concurred with the recommendation, to adjust the stop loss contract to cover for catastrophic claims that happened in the previous year and ultimately help you cap out your annual expense at a maximum. Before this change, there was no maximum after the calendar or after your contract year ended. So as of May 1st, you put into place a contract that has what we'll refer to as gapless coverage for any claim that happens both on the specific deductible level as well as the maximum amount for the town could pay. Previously, the town paid up and above maximum depending on how the plan operated through the year. So as we go across, you'll see employees, medical claims, RX claims, stop loss reimbursements. That's what you pay a stop loss vendor for any large catastrophic claims that come up, individual catastrophic claims. Then you have total cost of claims, which came in right at about $933,000, as well as the additional cost for stop loss and administrative expenses at $1,291,000 for the last rolling 12 months. The plan maximum, had the contract been in place correctly or had the protections in place in the previous year, like you have now, the plan max actually would have been $1,278,000. So in this rolling 12-month time period outlook here, the plan paid about $13,000 over the maximum amount. With the contract that you have in place now, there is a maximum that you will never exceed the maximum because the insurance company picks everything up. Previously, that maximum was kind of a fictitious number because of the way the claims fall. You'd never be able to hit the maximum. Any questions on this part before I go ahead? Okay. So as we look at it, the plan is performing to the maximum at this point in time. So as we look for a pricing standpoint for the coming year, we're going to go back to the first page, and I'll kind of skip you through a few. Fee schedule, just real quickly. If you go to the fee schedule dated 1/1.24 through 12/31, this is going to show you all of the different fees for stop loss, the aggregate factors. A lot of this is just for reference for you later. We've broken it down on the following page of how the cost actually impacts the town. If you move to the total cost of insurance for 2024, what we did here was we worked with your stop loss vendor to understand what the aggregate was, the worst case scenario, or the total cost of insurance, and then we broke it out by line. So on the left-hand side, you've got the plan year 5/1 through 2023 through 12/31/2023. Down at the bottom, you have the rates that are charged for employee only, employee spouse, employee child, and employee family. The stop loss vendor, based on your risk and the fact that you had essentially hit the maximum over the last time period, they were requesting a 10% increase in total plan cost from a insurance perspective. So average trend right now in the marketplace, medical trends running at 8%, pharmacy trends running at about 13%. So blended together, they were giving you what we'll refer to as a trend increase. However, I want to call out, there's a line item stated there, laser. We were informed that a high claimant may not be on the plan any longer. And if that is the case, that line item, that cost item can be removed. We just have to have a few things confirmed before we can actually remove that out of the total cost of insurance. If that happens, it actually brings your rate increase probably down to more like a 4%, 5% increase, which is below trend and below cost from a plan expense. And that is the total cost of insurance. So if that were to happen, and you were to perform the way you performed this year, these rates would protect you of not exceeding your annual budget based on the premiums that are presented here. If that line item is removed, like we said, it'll probably bring you down to right around about a 4.5%. And we can work with the professional staff here to confirm if we can remove it, and if we can, then at that point in time, it'll adjust down all of the rates for the plan costs. Any questions there before we go on?
Would we know that before the end of the year?
Based on timing, it'd be close. It'd be really close.
When's the requirement to pick it up?
So traditionally, an individual is eligible for COBRA for up to 90 days. So it's kind of right in that time period. They have to elect within 60 and pay within 90.
Okay.
So you're right at the cusp of being able to know it or not. So that is just something that we want to make note of. I mean, in future years, that if the individual doesn't take the coverage and that risk isn't there, the rates will be down in future years as well as the capital investment line item that I'll point out here. This is only a 2-year line item, and it essentially gives you the access to all the protections the captive gives you. It also sits as an asset on your books. So when you are to leave the captive at a later point in time, they will refund you that money. It essentially is buying you true sleep insurance where you don't have to worry about any new lasers. So if you hire anyone at a very high risk, the captive protects you against the laser risk at that point in time for those individuals. Questions? One of the things that have been proposed and we want to talk about is offering a second plan. This had been just something that had been thrown out, so we want to present one of the options that's available. The current plan on the medical offering 2024, current plan A, we're just going to assume that plan doesn't have any plan changes, and that will, remain the same. There is potentially a new option if you approve to go forward with it, where what we did was we wanted to find something that would bring down the employee's contribution if they chose to go with it. It adds a little bit more risk to them, only if they were to have major catastrophic claim situations happen. So in this case, the plan deductible for the second option would go from $2,000 to $4,000, and it would take the maximum out of pocket from 4 to 8. The idea behind this one is this is for your very healthy, potentially we categorize it as young, healthy individual that doesn't really use insurance, right? It could be anyone who wants to take it, but that's typically who gravitates towards it. If they go in for office visits, the office visits have remained the same, so they're not seeing any disadvantage when they go see their primary care doctor or specialist. Urgent care, same at $50. ER visits remain the same, and then retail pharmacy remains the same there as well. So the employee that's using it from a meats and potatoes standpoint, i.e. doctor office visits and pharmacy visits, they would not see much of a difference. It's only if they had catastrophic claims that they would. And it's the employee's choice, right? If you have employees that say, I love the plan we've got today, they can stay on that plan. This is just a second option to try to lower the cost for the employees if they choose to do it. And we do a lot of municipality work. I would say the majority of plans have 2 options. The majority of municipalities have 2 options, if not 3 in most cases. So, any questions there? From a cost of insurance standpoint for those 2 plans, we're showing you current Plan A as well as current Plan B with the 1 asterisk, and we can go off of your lead on it on how we want to handle the potential of the reduction with the recent information that was provided. There's about a 20% spread in pricing between each of those plans, but that doesn't always, from a contribution standpoint, you kind of have control over what you'd want to do from a contribution for that second plan. It would just be written more into the employee explanation for that second option. So you could make it very affordable if you wanted to. Dental, on the following pages as well, dental and vision just broken out for you. We don't anticipate any changes there. Those are pretty steady insurance products. We don't estimate that anything will really adjust off of those for the future year. And then, let's see if there's anything else major here to fill you in on. Rob, if you want to talk a little bit about the new programs for 2024 that are available.
Yeah. So I think first and foremost, the biggest one is the addition of an employee assistance program. And this is really, I think, one of the things that most employers, whether municipal employers or private, are offering. The event of COVID's brought a lot of light to somebody needing access to quality behavioral health, mental health options. Your medical plan covers it today, but it's covers it at a copay, within network, et cetera. And this is really a employee assistance program that could be added, and basically anybody, any employee of the town, as well as any family member living in their household, gets access to it. And so the program includes 5 virtual or in-person sessions at no cost to them. And this could be things for, anything from just general behavioral health, mental health, depression, suicidal issues, just, addiction, anything that's really detrimental to the employee's ability to work and function and be a productive employee. They can use this to get help for that. And then what would happen is, should somebody engage with the program, after their 5 visits are exhausted, the program would then help transition them into a member of the community that can continue on with their therapy, their counseling, their treatment, et cetera. So this is kind of just, CureLink is the provider of this program. They're basically charge it per employee. So it works out to be about $6,100 for the year, and the recommendation would just be a value-added benefit that could probably help just overall, mental health around with the members. So that was kind of the biggest one. The rest of these things, the KissX, the Cancer Care, the Smart Match, the Husk, and the not the virtual visits, I'll get to those in a second, but these other programs are really, when we talk about the total cost of insurance, in that, I mean, there are some variables, right? We don't know that somebody's going to claim like they claim every year. Nothing's guaranteed with how people use healthcare. So the ability to control your costs, really, when it's 70% of your total cost of insurance or more, is the claims. So what can we put in that can help people, lower or get access to lower cost of care? And so that's the KISS card. It's a direct relationship, direct contract, surgical benefit. So if employees want to engage with this program, they call the KISS card, so they can set them up with high value, lower cost providers in the area. If they go through with it, it's typically like a 40% reduction in that procedure. So whether it's orthopedic, MRIs, anything like that. So that's just a good service. We typically recommend that the employee would be incentivized, where their deductible and out-of-pocket is waived if they choose one of those providers. And so we can actually set that up if that's something that you would want to do. And the goal is to get them to a high-value provider. If they do it, they pay nothing out of pocket. The town benefits 40% savings on that claim. So that's kind of the goal with that. Similar, cancer care is really just second opinion, cancer specialist case managers that oversee any cancer diagnosis. We can just turn these on. These are all just things that are no cost. These are part of your membership within the captive. Smart Match is really helping people who are Medicare age and eligible to get information, get education about the benefits of Medicare. Should they choose to do that, obviously that's somebody that could be a high risk claimant on your plan is now better off on Medicare. So it's just educational, helping engage people to get Medicare information. HUSK is for pregnancy, high-risk pregnancy, things like that. So these are just programs that can really help in those high-risk, high-claim times of need for the employee and get them engaged with something that can help them and as well as help the town's cost as well. I don't know if there's anything.
One kind of final comment, because people always ask us, do the costs ever go down, right? Like that's number one thing out there. And I will tell you this. I think what we are seeing in the stop loss market particularly is we're seeing adjustments to that maximum. And this year alone, and you're a little too early, and you had what I'll refer to as you had a hot year for the last year and a half, 2 years from a claim component. We have actually seen the aggregate drop on groups that have cleaned up. We don't know if you'll clean up. The data's telling us maybe you will a little bit, right? It's starting to get a little bit better than what it had been. And with the correct contracts in place, we might start to see it. No guarantees, but I will say that we've had a number of groups that have gone into the captive in the last few years that this year they're seeing about a 2 to 4% reduction in their total cost of insurance. So we always say it's a crawl, walk, run approach. That's kind of our belief on managing healthcare. And those groups that are in that run process right now have actually seen that maximum come down for them. So as we look at it, long-term planning, this is really what the strategy is behind it. So any questions from the council or the team?
You'll have the agreements on this to me I'm hoping Monday?
Yeah.
Okay.
Yeah. The only thing that we'll need, finalize the stop loss will be just signature off on it. It's all related here in the pricing side of it. The big component comes down on the benefit plan, the additional benefit plan. That's really what matters the most on that side of it.
Anybody got any questions? All
All right. Thanks, guys.
Thank you.
Next, K2M Design, Public Safety Building.
Hey, good afternoon, guys. How are you? I'm Eric Prose. Can you hear me okay?
Yeah,
Yes.
we can hear you.
Great. And I have Carrie Colvin there in the audience, who's my local representative, but here to answer any questions. We could talk to you at length about the process we've gone through so far to do a facility assessment of the existing police and fire station and talk about some of the enhancements and improvements that could be made there for safety. I originally thought that Chief LeDuc would be there this evening to kind of be our eyes and ears on the ground, but folks, let me know if you'd like me to walk you through the process we've gone through so far, or if you have any questions, I'd be happy to do that. We could talk at length, but I do want to be respectful of your time. So I'll lean on you to let me know how much you want to understand, and I can be happy to share my screen and talk through some of the process if you'd like.
I think maybe if you want to just kind of do a quick summary on what you guys have completed thus far, and then what our next steps would be in terms of this process.
Certainly, happy to do that. Yeah, so what we've done, we did a thorough investigation of the facility and looked at, it's a relatively modern facility. It's got a lot of great benefits, but there are a few areas that could be improved for the safety of the firefighters, essentially. So a couple of those spaces would be, the turnout gear equipment that the firefighters put on when they're going into, those fire situations. They're not properly stored. To make a very long story short, what we've come up with is a plan for, there's an upstairs space in the existing building that can be sort of reallocated, right? You guys did a great job of thinking ahead about future growth. It's something we talk about all the time. I'm really glad that you guys did. So what we can do, we can move some spaces around to that upper second story there, and allocate some space on the ground floor there to be available for the proper gear storage, gear cleaning, the decontamination process that needs to happen for when these folks come back from a fire or even a medical scene. They need to clean their gear. We did a kind of a comprehensive study of the facility to find out a way to kind of modernize it and make it a little safer for everybody. So we put together a feasibility study for you guys and had a local contractor there, Core Construction, look at it and put a price to it. So we've come up with a kind of a list of priorities that we rank from, really critical items that need to be accomplished to keep the first responders safe, all the way down to, I hate to even say it, but the last thing on the list is a patio, so the guys can go sit outside and enjoy the nice days when they come to. What we did, we came up with a plan that, really prioritizes those safety items first. First and foremost, we want to make sure that those guys have a facility that supports their job and keeps them safe. So we've eliminated some of the extraneous items and really focused in on what we can do to improve this facility. And we have a cost estimate from Core Construction to do that work. And I think what we're looking to do here is really just kind of take the next step in modernizing this facility and make sure that it will continue to serve the fine folks of St. John into the future. So I guess if there's any questions, happy to answer them. I could talk for probably an hour about the building and all of the spaces, but I want to respect your time. So with that, I'll turn it over to you guys for questions.
So just kind of really quick, I know we were talking about getting a design completed on this, so that way at some point we can move forward to get this, building complete once the money is found for that. Having the plan done obviously makes a lot more sense to get it done before you find the money, if you will, so that way you know exactly what your costs are. Because I know based on your estimate here, it's not a definite number. It's kind of a pie in the sky number. With a proper design, we should be able to get proper quotes. And then if, the council now or in the future wants to go out and bond on this and other items that are needed for capital projects, then, they could consider that as part of the overall project for that. So, but if you want to kind of go through on what the design phase would be and then what the next steps would be for that.
Sure. Yeah, and to kind of build off what you had mentioned, what we've done here, and I apologize, I didn't do a very good job of explaining what we've done. We've probably done the first 20% of the design documents. We've gone out there, we've measured the existing building, we've looked at some of the spaces that we can kind of rethink a little bit. And I would say we're, maybe 20% of the way through that process. The next process is going to be about creating those construction documents that you can have contractors come out and give you those hard bids to do. Again, Core Construction did a really great job of looking at what we're doing here and understanding the commodity prices and the labor and all of the trades that are involved in these types of projects in your market. They're locally, so they've got a pretty good idea of what that number would be. So I would call it pie in the sky. I think we've got a pretty good idea of generally what we've got. What I would say though is that there's certainly more need than there is maybe the budget. So we've got a number of items that we could add to this list if the money were to be available, that we could fund that are I wouldn't say luxuries, right? They're kind of essential functions of the facility that we could always add. And we've gone through and we've created a number of, we call them priorities, priority 1, 2, and 3. And they rank from, keeping the gear storage clean all the way to, having a proper office for some of the police folks that need some office space. That was sort of our process. Again, the next step for us would be to go ahead and create those construction documents where, to put it in layman's terms, we've got kind of we're not a napkin sketch. We're not full on blueprints. We're somewhere in the middle there. So the next step for us would be to complete those drawings so you guys can get those bids in and be ready to do the project when the timing is right. I'm not sure about the funding on this, but it's one of those situations where we could have these drawings complete for you at any time, and then when the funding is allocated, the project can be done, and you select the contractor to do that work. But again, what we've done, we've started we zoomed out, looked at the whole facility, and really focused on those areas that are of the highest importance to the safety of the folks here. So I hope that helps to understand it a little bit more.
Go ahead. Sorry.
Done.
I have one more question as far as the fee schedule that you have proposed here. You got permitting and bidding, and then construction, administration, and closeout. Those two fees, obviously, we're not going to need initially. That's something that might happen after we identify where the funding for this is going to be. So is that something we could at least take out of consideration for this proposal at this time, or?
Yeah, if I understand it correctly, the next step would be to take, again, to use the analogy, it's not a napkin sketch. We're somewhere in between that and full-on blueprints. What we want to do is take the drawings to the next step. So you really have a good understanding of what you're asking the contractors to do, right? Have that full-on design prepared. And that's where we would want to take the next step to kind of then get those bids in. So yeah, to your point, the construction administration, some of those other fees, those are not critical at this moment. Those will be the next phase once you say, we want to do this project, we want to get it done. What we're asking is really just to get a little further down the road so we can say, we know exactly how many linear square feet of drywall we need. We know exactly how many square foot of concrete we're talking about. Those commodities that we want to have a better idea on. Again, we're about 20% of the way through that process. We want to get to that 100% kind of construction document so then you can have a better idea of what that cost might be. And if you guys are familiar, construction costs are a little crazy at the moment, but things are starting to settle down a little bit. Some of the inflation is still kind of taking off, but everyone actually has a better understanding of where the commodities are at these days. And that's kind of our next step, is to take the drawings a little further, get those drawings complete, so then you can have a better idea of what the cost will really be. And jumping back again, what we've done, we've built in a number of alternates there. So if, the budget is set at X and it comes in a little under, well, then we have the next step that we could take to, there's certainly more need that could be accomplished, but we're really focused in on those priorities that are focused on safety.
All right.
And a couple quick questions.
Sure.
What other fire departments or towns are you presently dealing with or have in the recent past?
Yeah, great question. So we actually down in Cedar Lake, we broke ground a few months back. They're actually, if you've driven by recently, they got concrete block coming out of the ground, and it's looking really great. So we're working with those folks. We're working with the town with Merrillville. We've got a station, their station number 74, that we're doing a very heavy restoration and renovation of their existing facility. And we're also planning their station number 73 that will be a new kind of ground up build there. Let's see here. Carrie, you might have to help me out, but there's a number of them in your local community that we're working with.
We've
Crown
worked with
Point is one that
Valparaiso.
we've. Oh, thank you. Valparaiso is a great one. Yeah.
Valparaiso.
Yeah. So we've got. Thank you, Carrie. Yeah. So we've got station number 5 and station number 4 kind of on the books. They're currently a 3-station community, and they really need to get to that number 5 in a hurry. And we're looking at revamping their downtown station number 1, their headquarters, into a new facility that might encompass police and fire, similar to St. John, where you guys have that combined public safety facility, and they're looking at partnering with Valparaiso University as a partner there. So that's another really great example of kind of a similar combined facility as to what you're looking at.
We are.
Let's see here.
Yeah, that's,
Okay,
appreciate it. Thank you. Thank
We
you.
could- I could go on and
Also
on.
working on a territory with all of Whitley County, so that's a little bit of a drive away, but
Yeah, yeah.
Thank you very much.
But yeah, of course. Thank you.
All right. Anybody else got any questions?
Yeah, with what you're talking about, the design fee and everything else, you're probably looking at over $100,000 for a design fee. To get the project completed, it looks like it's $900,000. So we're gonna need like $1 million to get this whole thing complete. We don't have it in this year's budget. We have a new town council coming in. And if this council decides to go with this, you're putting pressure on another town council. You're writing a check that maybe the next town council can't cash. There's nothing wrong with the project, but I think the main thing is, Joe said it, I think, a couple of times, where's the money going to come from? It's like a couple buying a house, they just got married, and we want this, we want that. They find out, whoa.
Amen, Wayne, so for sure.
I mean, it's a good idea, but I don't think we have the money to do this, and if we use it for next year, we're gonna tie up our budget. Again, I think there has to be more thought process in it, and I think the first thing would be, where is the money gonna come from?
Right. I think, getting the design done makes sense to get done. Getting the project done, again,
Well, okay,
to your
the-
point, it's something that the next council's gonna have to take a serious look
The
at.
design fee, though, is probably, I think we gave 15,000 earlier for you to come out and look at, if I remember right. So now there's another 90,000 that you're asking for. That's 105,000. Where are we getting the money from? Is it there somewhere in our budget?
I mean, based on the numbers here they've provided, they're looking at about 88,000, and that includes the construction administration and permitting, which that's about 19, 20 grand right there. So you're looking at about 68, 69,000.
But my
for-
question
for
is
the
then,
design fee.
where is that money coming from, that 88,000?
No, that's a very good question. In fact, if that's something that the council wants to consider, we could take a look at using the ARPA funds for the design on that.
But you don't want to keep using ARPA funds either. It's,
Well, I mean, I get it.
I mean, if we work with this longer, we might come up with some possibility, but the money's not there. It's like,
Yeah, I'm not gonna argue that, so as long as the fire department thinks this could wait, I've got no objection with that. If this is a burning issue to be done, that's one thing, but if the chief thinks this is something that could be taken care of and thought through in a timely manner next year, I'm certainly open to that idea.
and if we got a lot of new things coming into town, if a developer wants to donate something towards this, that's great.
If I may,
Yeah, that guy in
gentlemen,
mind,
I
that's
hate to
great.
interrupt. I hate to interrupt here. We do a lot of fire stations. We do them all over the country, and this is not a new conversation. But what I would add here, this is not we're not adding luxuries to the building. We're adding things that will keep your first responders healthy. Being a firefighter, the World Health Organization has come out and said it is leading, profession you can go into that will cause cancer. And what we're trying to do here is add functions to your building that will prevent these firefighters from getting cancer from breathing carcinogens, bringing these bloodborne pathogens back into the facility. Currently they've got diesel trucks that they fire up. They're blowing soot on their respirators and their masks that they're wearing to go into fires. So what I want to offer to the conversation here is that we're not asking for, again, not luxuries. These are life-saving functions that we want to add to this facility that were unfortunately not included in the previous design, and we were not available to be a part of that design. But these are things that will keep these firefighters healthy and help them retire and live a long life and not suffer cancer that we see running rampant in this community of firefighters. So I just ask you to consider that as anything we can do to quicken this process, move more hastily toward a solution for them, because currently what they're working in is very unsafe. And you know, the least we can ask of these folks is to serve your community. And I would say we should offer them a facility that functions well and keeps them safe. So I certainly don't have any you know, position here when it comes to the financing. That is completely on you guys. But the sooner we can come up with a solution for them, that would certainly be the better for them.
All right.
Thank you very much.
We had a couple of trustees in the room tonight. We'll ask them for some help. You guys got the checkbook?
A small one.
Thank you.
Thank you.
Thank you.
Thank you, Carrie.
All right.
Evening, council.
Good evening.
I did pass out the change order.
You did?
Yeah, so they have that
Okay,
in
so what you have in front of you is maybe a little something different than I've been approaching you with the last couple of months with. This is actually a negative change order to the project. This is stemming from a meeting that Mr. Wizardwadi, Mr. Schilling, and Mr. Pondinas and I had last month with the church. They're currently undergoing a site plan development approval, as well as replatting, which is kind of going hand in hand with each other. Their current, of what I've seen of the plans, the design would render our fence obsolete. As I said in the beginning of the year, the fence is really for safety purposes. There's anywhere from 6 inches to a foot of drop off from the sidewalk we're putting in down to the parking lot. And there's not enough really right of way to do much in there, so the fence was really our only option. So with their new site development, if it's approved, the fence would be a cost that we don't want the town to have to incur. However, with that, the council is being asked to place a portion of this negative deduction in escrow to allow further development that we cannot do with the project. As we all know where we're kind of sitting at right now with the project, we do not feel comfortable with asking the contractor to pursue more work at this time. So that's why you're seeing no new items being added to this change order. So this money in escrow would allow the development to be done on their own time and then seek reimbursements from the town at a later date for very certain items, just stuff that we were going to be doing with this project that just we don't have the time for. So that would be some additional concrete curbing and a little bit of sidewalk to tie in to the corner of the southwest side into the church parking lot there. So the overall look for it is they are trying to produce a plaza that would be more inviting to the corner there. So they're asking to work with the town. It's some things on the side going on to allow that to be a public shared space that they would maintain, but allow the public access to their property on. Some benches and some decorative landscaping items. But again, that's nothing that would be reimbursed that is outside of this project. We had no intentions of putting any landscaping in, any trees, any shrubbery, or anything like that. It would just be for the concrete items that would have been in this change order in front of you. However, we just do not have the time to ask our contractor to do that with the way this project has been going.
And they've changed their design and concept on what they wanted and.
Yeah, so there is this, what we're referring to as right-of-way negotiations has been very much developing over the last 2 years, especially through the design process, and has bled into construction a little bit. And so their latest design, again, we don't want to waste any of the town taxpayers' money, especially at $110,000 for this fence that would actually not be needed after they complete their work on their property. So I would be happy to answer any questions regarding this change. I know I don't have any items in front of you. I don't have their full design. But the last I seen of it, it definitely would render the fence obsolete, and there's no reason to spend that type of money on a fence that is not needed.
Sounds great. Come back with a few more like this.
Yeah, no,
That would be great.
I do believe in the end we will have a negative balancing change order. I'm not foreseeing anything that'll push a change order that you guys have not asked for us to bring to the council. So I do believe in the end we will be doing a negative balance change order. So things are looking good. it's a little testing out there at times, but I do believe we still should be on schedule to finish this project this year. And again, we just can't ask our contractor at this time to do any more work.
But we're still gonna spend 109,000 somewhere in that project, possibly.
That 109,000 is other than the money that is being asked to be escrowed, which would be approximately about $40,000 or $45,000. That's back in the council's hands. As far as putting other spots, there is some, a little bit here we can do here and there to tie in some of the loose ends. But no, I should not be pursuing any more of that roughly 70 grand that would be left over.
And while you're up here, have Passion come to our next meeting, our town council meeting, and let them explain why we're having the delays that we're having now with the project. They're sending other workers other places, and they're making extra money doing that, and we're sitting with nothing going on. The sidewalk across the street from where we're sitting should be finished. They left patches. I know they got to patch tie in a light that they hit the lines, but there's nobody working today. They should have been working today. They should have been ripping out curb. It's all blocked off. They should be ripping up the sidewalk. They should be moving the stone in that one on the south side to get it ready. It's what, October 19th? Pretty soon the plants are going to close. But if you can get their engineer to come to our town council meeting, and so we can ask them questions. Why all these delays? I know the public wants to know, and they've been pretty patient on what's happening with that project.
No, I agree. And Joe, I just asked us to hold we have rough weekly progress meetings on Fridays. Joe's asked us if he's going to host it tomorrow here at Town Hall. I've already reached out to them. They've already texted back, said they will be here. So we'll have that conversation with them tomorrow, and I don't anticipate any pushback.
I mean, it just makes sense. And with construction, a lot of things come up, but when you send your workers somewhere else to go fix another project, and we're left high and dry, it's like inviting you for dinner, and then, hey, I got to go, and I want dinner. You're not getting it.
No, I agree.
It's just sad. And the people, I think the residents have been very good with all the delays and all the stuff that's been happening. So, yeah, if they come to a meeting next week for town council and let them stand up where you're at and explain why.
That's not a problem. We will definitely make sure that they're here.
Thank you.
What was the original deadline for the project, or?
It has always been December 8th is the deadline. And again, for anybody who I haven't explained that already.
That's what it started out as, so we knew.
Yes.
In April, it was going to be in December of this year that it was going to be finished.
Correct.
How are we looking for that?
I'm going to stay optimistic till the end of the month. It's not, I've been saying this every month, it's not a whole lot of work. It's only the other half of 800 feet of reconstruction and some resurfacing on this side. I'm confident as long as they're actually here, they can get the work done.
Yeah, but to Wayne's point, there have been many, many days where they could have been doing some work on that project.
We have been tracking such things.
Yeah.
We have our daily inspection reports that say stuff.
Mm-hmm.
They've actually been giving daily reports that you get every morning, so we know exactly when they have no work on site. So,
which has been a lot.
Yes, I can agree with that.
All right.
I just wanted one last reminder, Jason, we are doing that NIPSCO. NIPSCO will be closing 93rd down tonight between approximately midnight and 3 a.m. at the intersection of 93rd and Kyleman to finish some pole relocation. And that they are going to detour people backwards through our Alcott detour just down to 97th Place, and that's just going to be overnight, and there should be no power loss. It's just they just need the intersection shut down for the amount of employees that normally show up for those kinds of operations.
What time should it be reopened?
They've only asked from midnight to 3 in the morning. So I mean, I haven't heard they're canceling. I know it's kind of raining right now. They're working with electric. I don't know if they're going to cancel yet. I was going to reach out to Kelly, this evening and see if they are going to be canceling that work, but Kelly's really good at coordination with me. I would assume she've already reached out if they were going to cancel to ensure another date was okay with the town. But
it's funny, they worked while the road was open over here.
Yes.
Reaching over the road and everything.
So Just based on what they're doing, I think it is safest to have them close the road down, and it is hopefully not traveled that often at that time of the night. So they will be out there this evening doing that work.
Is police and fire notified?
I've had some emails roughly with Anastasia and Tammy about things. They should know.
Okay.
I think it did go to them.
Yeah, they were definitely CC'd on that email.
Thank you.
All right, thank you.
All right, Mr. Toth, Hanover Township.
Good evening, how you doing? I got in front of you guys, I gave you a packet, some information and stuff. We've had some discussions, probably over the past year now with Chief Leduc and some of the Board of Safety and Mr. Wizawati about asking you guys to contract service for us for fire and EMS service in the unincorporated areas of Hanover Township that currently lie within basically St. John. We're talking about, the maps are in there, Chief Gillette did this top map, and it kind of shows you the areas that you would have to assume. Basically, you guys have all of it already anyway, except for some small parcels there. The biggest one being Emerald Crossing. We're just trying to improve the response times and stuff to that area of Emerald Crossing. Right now, we contract with Cedar Lake, and it is quite a long haul for them to get there. We're figuring we could at least cut that down, the response times, by at least 5 minutes, if not more, if they come from St. John. So, but we are proposing that basically, instead of just trying to carve out Emerald Crossing or something, it would be just easier if we would just draw some lines down 109th and just say everything from 109th north from State Line to Klein Avenue, which would encompass the other areas of Hanover Township, that you guys would take that over. Like I said, the bulk of the houses and stuff would be in Emerald Crossing. Outside of the Emerald Crossing area, there's not that much left that you guys already have not incorporated. You can see the parcels on the map. There are very few, especially on the east side. There's hardly anything left on the east side of 41.
So we would pretty much be going down all the way south to 109th.
We wanted to make it so that basically it would be every address on 109th,
Would be
north and south side of 109th, and then all the way to 101st, and then down to 101st. Just for clarity, make it easier for dispatch and stuff, so. We're looking at, just so you know offhand, we've been watching or tracking the calls and stuff, because we get our monthly reports on it. We're looking at about an average of 15 calls
a month.
in that area a month. So, like I said, it kept, probably, I would say 75, 80% of them are and not only ambulance out there, but mostly car accidents. That is that corridor there, 101st, and is pretty bad with accidents, so that's kind of what they run a lot of over there. Fires, not a whole lot. So we think it would be a good thing for everybody. The Emerald Crossing folks have been asking for a long time. We've talked about this. I'm going on 2 years now about talking about this, so.
And then, what would be the compensation for providing this service?
You have a contract on the back of that.
You got the dollar amount?
I gave you a rough draft. It should be in there. We are
It's like 40/20.
offering 40,000. It's an annual contract, so we can look at it again.
That's pretty simple. We sign one with Kathy every year to provide the.
Yeah, it's done quite a bit. It's the township says by law we have to provide fire and EMS services for our unincorporated areas, so we have to ask you guys to provide that for us. And we're just trying basically to clean this up so that, like I said, we're trying to get a little better response time in that in Emerald Crossing. It does take quite a while, and it's, like I said, you guys know where the Cedar Lake Fire Station is. It's quite a ways away, so.
This was reviewed and recommended by the Safety Board to you. This was also reviewed by Attorney Westland. He made some minor corrections which were taken care of.
Yep.
Anybody have any questions for Kevin while he's here?
And I actually want to give you money. I'm not asking for it.
Ready.
There you go. Anything?
I don't have any questions at this time.
No?
We would appreciate it if you guys would do it and accept it. I think it would be great for the folks in Emerald Crossing, and
We'll be glad to take your money.
we appreciate it. Thank you.
I ask a question?
Yes.
My name is Richard Niemeyer. I reside at 13339 Calumet Avenue, Cedar Lake, AKA Brunswick. The only question I had, and I mentioned it to Kevin, was when we get into this mutual aid. The fire chief is not here, so maybe it can't even be answered, but a question I have is, what kind of pecking order would we have for mutual aid in that particular area? Would it be Cedar Lake next? Would it be Dyer? Would it be Crown Point? And do we use St. John Crete Township? They're a mile down the road. That's just a question I have. Our duty as representing the township, and I am on the board, have been quite a while, is to provide public safety for that particular area. I won't be affected by it where I live, okay? But just to make sure that we are covering this thing, I would like somewhere down the road, somebody could answer that question. I'd appreciate that. Mike?
And you have a question on what the mutual aid part of it?
Well,
He's
the
asking,
mutual aid part. Let's say you guys cannot attend to something over there. Who's next in line?
Cedar Lake?
Okay?
well, we got
Township.
mutual aid agreements with, Lake Hill, Cedar Lake, Dyer,
So you
Cherville.
just want to know what that.
Do we
order
use,
is.
do we use Crete Township?
Do we?
Yes.
I'm sure they're on our, well, you just,
sure
that'd be
they're-
a
I'm sure
question
they're on
really
the-
for the
Okay.
fire chief.
I'm
but-
sure
That's
they're on
fine.
mutual aid, yeah.
So maybe we get the fire chief to get the gentleman an answer?
I'd just like to know that because
Question.
Yeah.
logistically speaking, it's right down the road, see?
You can talk to him tomorrow.
Yeah, I can call Kevin tomorrow and find out. It's just, I know they have a pecking order, and I'm pretty sure I'm pretty sure your second call is Lake Hills
Yeah.
as far as for EMS services. So I know you guys use Lake Hills, and then you probably, and then you go down the line to Cedar Lake and.
Cherville,
You
yeah.
know, they bring up the Crete thing all the time, but then you gotta deal with another state and their dispatch area too, so.
Mike, I'm
sometimes
not,
it's
I'm
faster
not
to go
disputing
through
that.
your-
But I'll go back to this. It didn't hesitate anybody to develop that thing and pick up Aqua, Illinois. Okay? That's mainly the reason you guys don't have that particular parcel within your town.
True.
I mean, let's be realistic about this thing. There's a state line there. I understand all that. But there's cars go back and forth every day. I mean, that's all I'm asking. Because as a responsibility, I feel as though we need to know who can be called. I mean, are they gonna be standing out their front door watching the building burn till somebody decides to call them, or what are we gonna do here? That's all. Thank you very much.
Just
Yes,
so you
ma'am.
know, I do have an
Yeah, you have
agreement,
property
a
right there.
contract with St. John and Lake Hills.
Thank you.
Yep.
And I can tell you that Chief Adams from Lake Hills said that St. John, they have they're toned out at the same time. St. John and Lake Hills get the calls at the same exact time.
But I think they've expanded on that even more where, like on a lot of their fires, they tone out all 5 of them fire departments at the same time, so.
Yeah.
You know what, Mike, you're right. I think recently,
I think that's been in effect for the last year.
Yeah, because if there's a fire in Dyer, yeah, they get toned out on that.
All right.
Yeah, yeah. Absolutely.
Kathy?
Hello, everyone. So you have that interlocal community service agreement before you. Can you hear me? I bet, is that better? Thanks. So I just want to just give you a little history. There was, at one time, there was it was called a Tri-Town Ministerial Group that had met, and they would collect funds, and they would provide police departments with gas cards that they could use at their discretion. if they came across somebody that had no fuel or a transient, somebody, you know, that was stranded. And they disbanded, I want to say, at the end of 2019. So I do work with fire, I work with the police, and I would, from time to time, I will receive calls from the police asking if I could provide a gas card. And and in September, I went to a trustee township conference, and I found out that I can, by state statute, enter into community service agreements with nonprofit, and we can also do it with interlocal agreement with government. And so what I am able to do is provide gas cards to each of the police departments, and as a community service. So in exchange for me providing the gift cards, they agree that if they come across a motorist or somebody that is in need of gas, that they can provide these. So I'm really excited about this because it's just a matter of the council agreeing to this. But there's nothing on your part except for there is stipulation that there has to be internal controls within the police department for these gift cards. It's a term of whenever they run out, they can recontact me. And then also I've based them on the size of the departments. So I believe I've been told that there's like 28 in the department, and so that's how many gift cards. Just trying to come up with a number.
Issue these.
If they request them, once they're gone, then we would go through the same process again, interlocal agreement.
Just recently, like last week, police chief was telling me that there was a motorist, a young lady with kids, ran out of gas. So the officer actually did go and purchase gas out of their pocket to go get them gas. So this is a fantastic thing. Yeah.
It's a great idea.
It was, when I heard that I could do this, I jumped all over it. So I had to, get a resolution that the township board approved me to enter into the community service agreements, interlocal agreements.
I
And
take that back, and I'm going to get yelled at. It was actually our fire department.
Okay. But regardless,
I just
yeah.
remembered who said it now.
Now, who would be in charge of making the internal controls? Would that be the town of St. John?
You, no, in this agreement, it states that that the gift cards are subject to all police department internal control and procedures. So I do know, I spoke with a chief in Cherville, and they had received a lot of gift cards from this Tri-Town Ministerial, and they would just keep a log. And the log would say, like, the date, the officer, the circumstance, and so they kept their own internal controls. And so per the agreement, I'm trusting that the police department will do the same thing, and then request and if they have exhausted the gift cards. So and I think it makes sense to keep the control within the police department. So, and you're right, and in that case, Joe, like if the fire, something like that happened, they know that they could contact the police department, yeah. But and that's not the first story I've heard where they will go and actually just go out of their own pocket and pay for the gas. And, I'm able to do this within my budget. It's a way that we all work together, so, and then they don't have to feel like, they have to call me either, so, yeah.
Well, that's very nice, Kathy.
Thank you.
Thanks, Ken.
Thank you very much.
You're welcome. And I'll see you next week. Thanks.
Item B, discussion policy for ambulance service for employees while on duty.
So right now, there's no policy where, if an employee is feeling kind of queasy, or if they're working in a manhole or something like that, and they're just not feeling well, or if a cop pulls over someone and, they're using drugs or something like that, and they just don't feel right after that. There's nothing in our policy that says, okay, we'll provide an ambulance to take them to the, hospital, for whatever reason, okay? So, and if they're hurt on work, usually it's covered by workers' comp, but workers' comp's not gonna cover, I'm not feeling well at work and need to go to the hospital. So that would usually come out of their insurance. But in addition to that, because they came to work, they're gonna end up paying a substantial amount because it only covers so much of that bill. So the recommendation is to kind of develop a policy where if an employee is taken while they're working on duty by ambulance to the hospital, whatever the insurance pays, that's what we agree to take, and then that would be that. It's just that, even if it's a workers' comp issue, we would agree with the same terms on that, but we just want to develop a policy where if someone needs to go to the hospital, then they can go to the hospital and not have to worry about getting an $800 bill.
Have we had a few situations like this year already?
We have had a situation like that. That's why we're asking for the policy. So if that's something, we'll work on developing the policy,
Do you
but I
have a
wanted
rough
to.
draft of a policy, or?
Not at this time. I wanted to put something together, but I wanted to see how the council felt about it before we moved forward with it. We can have it ready for next week.
Do
I
other
mean,
towns have something like this? Because I could see both sides of that, for sure. You want to be gracious, and if you can be, if it's reasonable, but we want to be mindful of the taxpayer dollar at the same time.
Well, the problem is in a specific situation, if an employee went to the hospital thinking it's a work-related issue, and then workers' comp denies it, that becomes an issue too. So in terms of the cost for the ambulance ride.
What employees is this involved?
Everyone, all town employees, not just any specific department. This would be all town employees who are at work or on duty. If anything happens, they won't have to worry about paying an ambulance bill at the end of the day.
Do you know if Schererville or Dyer or Cedar Lake had something like this?
I don't know. I can have the chief reach out to them and find out.
That'd be great.
Mm-hmm. But just something to consider, and then we'll work on developing a policy on that.
Okay.
Okay.
Any questions? All right, moving on, task orders.
Good evening, Council. Dave Schilling, Robinson Engineering. Just because it's the first on my stack here, I would like to start with the service line material inventory for the water system. We have a task order in your packet that had received favorable recommendation from the Waterworks Board in September for the first level, which I'll get to in a minute. But the basis is this kind of all started with the Flint, Michigan water crisis back in 2014. The federal government took action, and it's now trickling down to the states. So particularly for Indiana, the inventory of all water service lines is due by October 2024. So we have about a year to get the inventory prepared. Just as a background, while lead was officially outlawed as a water line in 1986, we typically do not see it in anything installed after like the mid-1950s. In discussion with St. John Water staff, nobody has ever seen a lead service line. That doesn't mean there's not any, but it does look good, which is typical. I mean, when you go from private wells to a water system, when that water system is established, likely in St. John was after they stopped using lead lines. So what the Waterworks Board, there's a lot in here. On page 4, there is 11 line items of different ways we can get through this service line material inventory, and the Waterworks Board just gave a favorable recommendation to number 1, which is a desktop inventory. There's no field investigations, there's no survey, there's no website. It's just going through records and having interviews with staff to determine that, and we believe, particularly for St. John, that is all that is needed.
Do we have to certify that we have 100%, with 100% certainty that there are no lead service connections at some point?
Yeah, not just that there's no lead, but that each line has a material type. You know, could be galvanized. Most of it's going to be copper. Some could be plastic,
Now they're
galvanized.
gonna have to go
other
down and
stuff you gotta-
identify all these, or?
If we don't have confidence that we can get a good answer from the desktop inventory, then we would come back to you and say, hey, we need to move down to this number 2 to do the field investigations. And we know from historic aerials, you know, which neighborhoods were built after 1960. We could just rule those out completely. And it's just those, you know, around 30 homes that would need the field investigations if we get to that point.
Wayne, you did a lot of the inside work on, and looking at some of this stuff. Did you ever see any kind of copper connections from the water service? Or, excuse me, lead, sorry.
Copper, yes, but,
Lead.
no, there's some galvanized, there's galvanized inside the houses. I haven't seen it, I mean, but that doesn't mean it's not out there, but I wouldn't think so. And I've been to all the older houses up until 4 years ago, I was in every house, every business. We would see it, and now because of the copper, they're going with, PEX.
Right.
So, I wouldn't think we have any, but.
In 10, 20 years, they'll say that's wrong too, PEX.
But in this number 1 desktop inventory, we would go through town records, any meter cards, meter replacement. We'd go through all that to document it in a way that IDEM would accept it.
Okay.
All right.
The other task order on the table is GIS updates for utility atlases. We did break it down between the 3 utilities: water, sanitary, and storm. Water did give a favorable recommendation in September. Sanitary board did on Tuesday, and stormwater did last night. Between pages 2 and 4, we're looking at $32,000 for water, $20,000 for sanitary, and $38,000 for storm, and that is based on the backup documentation that's in the task order of, you know, what we have on record, what the town has on record now, and which areas are missing. We did determine at the water board meeting in September that the town already has an ArcGIS account, so that extra $1,000 per year would not be necessary. The town would have all this data after we prepare it. It would be, the town would have access to it. The town would own the data. It would be under the town's GIS, ArcGIS account, not under Robinson Engineering's. So, and there's this kind of, like I told the sanitary board on Tuesday, there's other benefits to this. Getting everything in state plane coordinates allows, you know, smartphone access to find utilities in the field. You could move on to the next step with interns or however you want to do it to actually get the coordinates in the field. It sets you up for asset management. You could say, you know, this hydrant was replaced this year, this valve was exercised this year, and you could start building your asset management for your 3 utilities as well.
Any questions?
And then these figures could be a lot higher if we don't have all the data.
Correct. We would come back and explain what we have and don't have. But yeah, this is based on assuming that either as-built or design plans are available from the developers or the developers' engineers or records that the town has.
What do you got here, Joe?
These are the listings for the additional appropriations for the various funds. We got total for the general fund of $638,960. MVH at 413, $4. Parks, 11,361. Indiana Art Grant, sorry, 658. The ARPA, 1,113,572. The NERC NDOT LPA grant of 133,892. The Parks Memorial of 1,500. The Cume Fire, 7,200, and road impact of 210.
Any questions over any of the additional appropriations? All right. Moving along, what do we got? ARPA fund request for the public safety HVAC system?
Yeah, so you have two requests to purchase here to look at from Mechanical Concepts. One's for building automation upgrade, and the other is for a refrigerant leak repair. These are obviously for the public safety building. As you know, we've got employees that live there as firefighters. They have living quarters in the building. We also have some hazardous substances that are sometimes brought into the building after fires and stuff like that. We need to keep all of the bad stuff out of the building, carbon monoxide from the vehicles, the trucks, stuff like that. This requires 24/7 air circulation, proper air handling, air conditioning 24/7, and heat balancing all of that for 365 days a year. So they need to maintain a negative air pressure within the building as well. There's also an energy management system that hasn't been functioning properly over there for several years. So they need to get this corrected. So very serious long-term necessity for the building. It is recommended by both of the chiefs that we get this work done as soon as possible. And then my recommendation would be to take a look at using the ARPA money. The total on this is $111,987. We can have a resolution drafted for this for the next council meeting, if that's the direction of the council.
So this is unoperable equipment that's being fixed.
The building automation system is not working.
It's outlived its usefulness.
Well, there is, but it's not working.
It's worn out.
It's just not working. It's a kind of a ragtag system.
Just gonna replace it, Joe.
This will replace that, and they will make the repairs. They have a heat air conditioning balance system, so the heat runs 24/7. Air conditioner runs 24/7 when it's called for. So it balances it out based on what room's in use and stuff like that. So that's what the automation system will handle. And a lot of the bigger public buildings, that's what they have to maintain the negative air pressure, to maintain efficiency more than anything. So that way you're not running equipment 24/7. That ought not to be. So this kind of resolves a lot of that.
Any questions? And you'd like to use ARPA funds for this?
That would be, my suggestion.
How much is left in our?
There's over 900,000 in there right now. That's unappropriated.
Is that like the public works trucks that's taken out of there? Okay. And anything else that we might have already?
Yeah, anything else that we've earmarked is kind of earmarked out of the ARPA fund, even if it's not fully appropriated.
Is that accounting for some of that ARPA funds we got from the county for
No,
some projects?
that's not.
So that's outside that, so
That's
there's
not. We'll be probably talking about that later this year on what we're gonna, what we might be doing with that to finish up the Kyleman project.
Okay.
All right. Next, the 2024 salary ordinance.
Get my notes.
This is not gonna be on the, agenda next week. This is just for,
No, this will be first reading for next week,
all right.
and then second reading will be in November. Or adoption for November.
Any highlights you wanna go over on it?
Yeah, just a few things. So, all the employees would be receiving a 3% cost of living increase. While there might be some that are getting promoted or and whatnot throughout the year, so there are a few that are going to be receiving a larger than 3% increase. Start with the public works. So we've got a new position for the foreman crew lead, a class 4, class 7, and class 8. The class 7 and class 8 will be promoted through seniority. There's 2 individuals that have been there for quite some time that will be promoted in there. So moving forward, the new hires will be coming in at a class 16. If they have a CDL, they will advance in a class on January 1st following their date of hire. Anyone obtaining a CDL will not advance in class and will remain at class 16 until such time as they obtain a CDL. So in order to advance or be hired beyond a class 5, they must have a WT3 groundwater license. And that'll be spelled out in the ordinance as well. Building and planning, the salary for the director was brought back to the I call it the pre-Mendoza, I'm sorry, before Sergio. We had made an increase in 22 for Mr. Mendoza's salary. This brings it back into where it was, and then giving the increases as well. We did that in order to retain Mr. Mendoza at that time. There still remains an open position that was in the 23 budget that'll remain in the 24 budget for a full-time code enforcement officer. Our FTEs for the police department will be at 25 with our police chief included in that number. Lieutenants will be going from $44 to $45.32, sergeants from $43.38 to $44.68. Corporals from $39.96 to $41.16 with 1 additional promotion to corporal for a total of 6. Patrol officer first class will go from $38.68 to $39.84. Patrolman second class $35.86 to $36.94. And we will have 1 promotion from probationary to second class that's considered in the salary ordinance as well. The chief has requested an increase, and it's stipulated in the ordinance that the police specialist stipend go from $200 biweekly to $300 biweekly. This pay incentive is for the detectives, supervisory, and command personnel. This is an increase on top of that 3%. That would be their stipend included in that as well. So, and that would impact the 4 individuals in the department.
All right.
So the fire department, much like the police department, we're structuring the same methodology for the fire department. All firefighters are receiving the same 3% pay raise. For the 3 lieutenants, 1 captain, and 3 battalion chiefs, we've done away with the hourly stipend, and that's going to be reflected in an hourly rate. So battalion chiefs who are paramedics will be at $28.54. Currently, we'll go from $25.72 to $28.54 per hour. Battalion chiefs who are EMTs will go from $25.04 to $28.22. Captains will go from $23.54 to $28.22. Lieutenants will go from $24.97 to $26.28. Firefighter first class will be from $24.72 to $25.46. We have only 2 positions authorized in the salary ordinance, which can be a combination of probationary firefighter, probationary paramedic, or non-probationary paramedic. So when you get to the firefighter section, you'll see that there's 2 authorized, but there's several different class options that they can use, but either combination, it's only 2. Also in the salary ordinance, we have the position for the a director of mobile integrated health. This was the proposal that the fire chief was talking about in quite in length. If that doesn't happen, then obviously this won't happen either. There's also an item for the mobile integrated health staff, which would only happen, again, if the town is successful in working through an agreement with one of the hospitals to fully fund those positions. If not, those positions would remain open. They would only be paid 100% out of the MIH fund that would be established at that time. That would need to be done at a later date because we don't have the money right now for that, but it's still entertained in the salary ordinance. Finally, based on the updated insurance costs for 2024, we've included those in the salary ordinance as well, spelling out the methodology for calculating the total cost of insurance and the employee's portion broken down within the ordinance. The town, as you know, covers about 80% of the total cost of insurance. This would be the last year where we have the subsidy included in there, and again, I broke that down in there as well. This provides the option B is also included in there, as Matt was talking about earlier. So we've got a lower cost option in there as well. And the only additional staff member for the Parks Department is a part-time recreational maintenance at $13.25 per hour. And that's all I have on that.
While you brought up the building and planning, how's the search for a new building and planning director going?
We have an interview with a candidate next week, I believe Monday or Tuesday.
Who's all involved with the interview?
I asked one of the incoming council members, and they declined. However, if you're interested in sitting in it, Wayne, I don't have a problem with that.
It doesn't interfere with my schedule. And then,
Okay.
you read all that stuff off, all what the people are getting. What's it cost right now, and how is that gonna change our budget? How much is that gonna increase everything?
Well, you had a copy of the budget already. I don't have all of the exact numbers. I do have the breakdown of exactly by fund and everything, if you'd like to take a look at that. I can send that to you.
Either that or just figure it out and tell me, okay, we've gone up $1 million. I'm just throwing that out there.
Yeah.
If you can do that, that'd be great.
I would love to know what the total increase in percentage for the salary, just.
The total?
Yep.
Yeah, I've got the 2024 number, so, yeah. I'll send that out to you guys.
Resolution for the uncollectible debt.
So the resolution for the uncollectible debt, this is a routine resolution that we pass. The total for the uncollectible debt portion is $307,999.64 from January of 2023 to June of 2023. So that will be presented to you at your meeting. You don't have the schedule in your list, but you will have the schedule at the next one. She didn't want to burn paper twice. But if anyone wants to take a look at it, I do have a copy of the full schedule.
All right.
And is this largely, again, from just underfunding from the federal government for us doing our EMS services for our town? Is that largely what this is, this write-off?
These are, a lot of these are from, the Medicare contractual agreement. So under the Medicare contractual agreement, if you accept a Medicare assignment, you agree to take X amount of dollars and not anymore. Even though you might bill for 1,000, you're only going to get whatever Medicare pays you because you agree to accept Medicare assignment. Exactly. The rest of that has to be written off.
So, yeah, of course, we need to provide services to people in need for sure, but I do think it's somewhat unfair for a big federal government to provide a payment in below what your billable rate is, that they know is below basically your cost.
That's how Medicare stays solvent.
Transfer payment from us to the federal government, unfair. So. Just like to voice it every year. I think it's a rip-off,
It's
so,
either-
right.
That's how they stay
It's either
solvent.
that, or
Yep.
you get nothing.
Right.
Yeah.
So we have to do it, no problem, but, you know, we must take care of the people in need, but, that's a lousy deal.
That's just like your insurance. You go to the hospital.
Lousy.
The insurance company pays 60%, and you get the rest of it shoved.
Any other questions?
Yep.
Acceptance of the performance surety for Gates of St. John, Unit 21B, 21,331. We got two of those?
Mm-hmm.
Any questions on those?
Nope.
All right.
One final thing, if I may, to discuss, I put it in your packet as well. Just in order to, we've got a snafu that was not included in the salary ordinance for 2023, which was a $750 amount for the police reserve officer. I'm just asking the council to approve that at the next council meeting.
That's an amendment to the.
To the current salary ordinance, yes.
Current salary
It's
ordinance?
included in the 24 ordinance, salary
It
ordinance.
wasn't added in?
It was not, the language was not in the 23 ordinance.